Hi, Alvin DeLeon here, and you are watching episode 49 of the 3-Minute Health Tip. And in this episode, I'm going to talk about carpal tunnel syndrome. Carpal tunnel syndrome is a common condition that we've all heard of, and it's often tied to people that are working with computers a lot. We're taught that it's related to an overuse type injury that affects the median nerve that runs through the carpal tunnel, causing numbness, tingling, and pain, often in the wrist and to these 3 fingers. As we know that there is real conditions that are involved that cause overuse type injuries. I covered that topic way back in episode 8. So if you could go back to that episode so you can really see the difference between what's known as an overuse injury and what's an injury caused by a biological conflict. And so when we're talking about carpal tunnel syndrome, we're going to look at what is the conflict shock tied to carpal tunnel syndrome. As we just mentioned, it's tied to an inflammation, a swelling of the tendons around the carpal tunnel, and because of that inflammation and swelling, it crowds the median nerve that's there, causing the pain, numbness, and tingling that people often experience. The carpal tunnel syndrome, the conflict that's tied to it, is what's known as a performance devaluation conflict. A performance devaluation conflict. This is very similar to the knee pain that we covered in the previous episode, and it's how you perform, or you devaluing your ability to perform with that part of the body. So when it comes to the wrist or carpal tunnel syndrome, you are devaluing your ability to use your hands and your wrist. And this is why it's often tied to activities that are associated with the hands and wrists. Keyboarding, typing, it could be somebody that works construction, hammering, using a screwdriver, somebody that's in a music performance, or even a dancer. We've had cases of people dancing and using their hands and their fingers and devaluing their performance, particularly for a competitive dancer. We've had cases of people having that finger or hand pain because of having a new boss at work that changed their entire routine of what's expected. There's a time restriction now in terms of their ability to type up administrative work on the computer, and when they're not fast enough and they're falling behind in their ability to create memos or to type those emails, they start to feel devalued in their ability to perform that manual task. This is also the case for a lot of musicians and people that are performers, drummers, guitar players, piano players, when they're at a competition or they're expected to perform at a certain level and they don't, and that's a shock for them. So the unexpected conflict that often will trigger these carpal tunnel symptoms has to do with a performance devaluation. What's going on in your life? What's going on in your work environment where you're devaluing, or somebody devalued, your ability to perform a manual task. If you're suffering from carpal tunnel syndrome and you've worked in that keyboarding job or office job for many years, and the pain only started 3 months ago or 6 months ago, look at what unexpected stress happened in your work 3 months or 6 months ago when your symptoms first showed up, and make the connection if it has anything to do with you feeling devalued in your ability to perform a task using your hands. And your ability to become conscious of that, make that connection, and change that perspective should hopefully help alleviate some of those carpal tunnel symptoms as you go get your therapy with your physiotherapist, your chiropractor, your massage therapist, and hopefully that can go a long way in minimizing your symptoms and finally giving you relief. I want to thank you for tuning in to episode 49. I hope that health tip is valuable, and I'll see you at the next episode.